Good afternoon, Professor. Let's go ahead and begin assessment for week 3. Hello, Bear Bear. Nice to see you again. My name is Richard Van Dyke, and I'm also a nursing student from Chamberlain University. Here's my badge. So today, we're here to do another assessment. Is that all right with you? Great, thank you. It should approximately take about 10 minutes or so. Is it all right to begin? All right, great, thank you. Bear Bear, would you mind telling me your age? Bear Bear states that he is over the age of 18 and that he does consent to be recorded during this interview. All right. Bear Bear, tell me, what's your ethnicity? He is a brown bear. All right. Would you mind telling me your name for me, your full bear? All right. Full name is Teddy Bear. All right. And do you know where you are? You're at home right now. Great. Do you tell me approximately what time it is? About 1 o'clock. All right. Sounds good. And do you know what the situation is right now? He states that he does recognize that he is being recorded for a health assessment. Great. Thank you, Bear Bear. All right. At this time, I'm going to go ahead and check Bear Bear's symmetry. And starting at the top of his head and looking downwards, I'm going to see that his head and body and peripheral sides appear to be symmetrical, and his growth appears to be appropriate for his age and being a bear. Also, I'm going to note that his hair is well and evenly distributed, and his color is appropriate to being a bear. All right, he also looks like he's got a well-nutrition, well-established diet. His skin appears to be warm to touch. Bear Bear, do you mind if I check your skin turgor? It's just going to be a slight little pinch here. No tenting with skin turgor. All right, Bear Bear, I'm going to go ahead and check your pulse. Is that all right? Great, thank you. Great. Bear Bear's heart, after measuring it for 30 seconds, is going to be times 2, and his heart rate is around 68 beats a minute. On the other half of the minute, I went ahead and checked his respirations, and he's right at about 14 respirations a minute. All right, Bear Bear, I'm just going to check your temperature at this time. Bear Bear is 98.6 degrees. All right, let's go ahead and check your pulse ox. Pulse ox is putting him at 98% and also verifies that his heart rate's around 68 to 70 beats a minute. Thank you very much, Bear Bear. Are you currently in any pain or discomfort right now? No? No? All right. Bear Bear states that he is nothing but love. All right, great. All right. So let's go ahead and check your eyes. And now at this point, I'm just going to go ahead and shine a light in your eyes, all right? Okay. All right, thank you very much, Bear Bear. I'm going to go ahead and have you follow this pin light. I want you to move only your eyes and keep your head as still as possible, okay? Great. Bear Bear states that eyes assessment came back as Perlo. His pupils are equal, round, and reactive to light, also showing accommodation. All right, thank you very much. All right, Bear Bear, I'm sorry I don't have a tuning fork, but we can go ahead and pretend for this assessment that I have a tuning fork. Bear Bear, would you mind telling me if you hear this? He states that he does hear it. All right, Bear Bear, got this. And he hears it there as well. Okay, I'm just going to rest this on top of your head. Tell me, do you hear that in both your ears? You do. Okay, perfect. So I'm going to go ahead and say that he can hear bilaterally using a tuning fork. Also at this time, I'm going to go ahead and just do a visual inspection of his ears. Okay, internally and externally appear to be great without any lesions or any blockage appearing. All right. Bear Bear, I'm just going to go ahead and take a look in your nose. Is that all right? Okay. Okay. I'm going to go ahead and do this for you since you can't move. So we're going to go ahead and follow what I can do and just... Okay. Now this side. Great. All right. I'm going to go ahead and say his nostrils are patent on both sides bilaterally. All right. Go ahead and open up and say ah for me. Ah. I'm going to say his teeth are well cleaned. His breath is normal smelling. I'm going to say his mucosa membranes are moist. Teeth appear to be intact. And his tonsils are at +1. All right, thank you, Bear Bear. At this time, I'm just going to check your neck. Okay. Okay, his trachea appears to be midline, and his thyroid appears to be a normal shape. It does not feel any abnormal growth or abnormal size. All right, now I'm just going to go ahead and check your lymph nodes. Checking the back of your ear, front, occipital, regular, submandibular. Okay. I'm going to go ahead and note at this time that his lymph nodes appeared to be without swelling. All right. How you doing so far? Okay. He says he's doing all right. All right, Bear Bear. At this time, I'm just going to go ahead and check your lungs. So what I'm going to do is I'm just going to use my stethoscope to go ahead and I'm going to just listen to the front of your chest and the back of your chest. Noting that since Bear Bear is a male, I don't have to worry about the breast. However, on a female, I know that I need to ask first permission to do it. And then when handling the breast, I use the back of my hand. All right, Bear Bear. Go ahead and take a deep breath in for me. Again. 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 And at this time, I would be getting to the breast tissue on a female, so I'm going to go ahead and just pretend to lift up. Great, thank you. All right, at this time, Bear Bear, I'm going to go ahead and we're just going to turn Bear Bear around just to do his backside. Now, Bear Bear, during this time period while you're standing up, if you feel lightheaded or dizzy, please let me know and we can address that, all right? Okay, Bear Bear is standing up at this time. Once again, this time I'm just going to go ahead. If I cannot physically see, I can go ahead and palpate for the clavicles and avoiding the, I'm sorry, excuse me, not clavicles, scapular bones to avoid any bony prominence, especially on the spine. All right, Bear Bear, go ahead and doing a C pattern again. Great. I'm going to go ahead and say that Bear Bear is clear to auscultation bilaterally, anterior and posteriorly. While I was assessing Bear Bear's movements of turning around, I was able to also see that his anterior posterior is less than his width. So I'm going to say that Bear Bear is not barrel chested at this time. All right, Bear Bear, how are you doing? Great. All right, great. Thank you very much for your time, Bear Bear. And at this time, if you need anything, you have your call light. And just give us a call if you need anything. Go ahead and wash my hands. And that'll be the conclusion of this week's assessment. Thank you very much.